Hi, my name is Casey Cloud, and I'm the Residency Program Director here at Texas Health Harris Methodist Hospital in Fort Worth, Texas. Thank you for stopping by our showcase booth. We hope that you're able to find the answers that you're looking for, and we definitely are looking forward to meeting you.
I would say what first drew me to Texas Health Harris would be the acute care focus. I was really interested in all the rotations and thought it'd be really good to help me be a well-rounded pharmacist. But I think what made me want to be here was my interview. All the people here were really great. I felt supported by people without even having a position here. People, had just really natural conversations, as well as our RPD is really great. She's genuinely interested in you, and I think that's one of the most important things.
I chose Texas Health Harris Fort Worth Methodist because of the diverse set of rotations offered, specifically renal transplant and 2 infectious disease rotations, one of them being antimicrobial stewardship. Secondly was the diverse set of patients our hospital serves, from stroke patients to congestive heart failure to trauma and to the neonates.
So the question is, what do we like about this residency program? And so I think we could both say that we love the people here, and that's just not just including people in the pharmacy department, but that's also the doctors, the nurses, basically everyone here is like really great to work with, and I think that's one of the best things. We have a lot of like informal mentorships and stuff, and then obviously you make friends.
Exactly. And then secondly, another thing that we both like about this hospital is that the acuity and the variety of patients we see. Because we're one of the biggest hospitals in downtown and we have the neighboring cities, all of those neighboring cities send their patients to us. So we get to see the higher acuity patients. And basically there's never a dull moment. We have the craziest cases come by and we're learning so much. I think that's been a great experience with this residency so far.
Yeah, and I can go off of that too. We were talking about earlier that even though we're a private like hospital, like you don't suffer like we split like ER cases with like the public hospital like right down the road. There was like a survey that came out a few months ago that we're like 4th busiest ER in the nation, and I think that's a really cool thing, and that definitely like reflects in like our patient load. But yeah, I think that's like also going as to like the rotations, like they've been really great experience. Like everyone tailors our experiences to each other. I've had a couple ID rotations, but I don't want to do a PGY2 and ID, and so my rotation was completely different than hers.
Yeah, I got to see all the soft skin tissue infections, but she got more of the cooler cases, which is fine because I had my rotation off in the beginning of the year, but we got to see so many of the cool cases, and the clinical specialists that we've had on our rotations have been great. They're a wealth full of knowledge, and they've been teaching us so much, and we've learned so much from them so far. And then also going into our code blue longitudinal, so making our code blue responses longitudinal has been a great experience because getting formal feedback from our preceptors when we go to code blues and getting tips of what to do better next time has been an easier process compared to the past years.
Yeah, and then I think like one of the cool things that not every hospital has is like the investigational drugs. And so like we've been involved in a bunch of clinical trials, and we had a couple before COVID, but we got really involved in COVID, and so now we have a lot more opening up. So it's like really cool to be able to see like on like that side, and like to not just like read about the research papers and to like be a part of it. And it's a really neat thing.
And yeah, and both of us have done drug monographs for these new investigational drugs, so it's been a great learning experience because we've both never been in investigational drugs, so it's been a really eye-opening experience for us. And then I think another cool thing is that the sushi in this hospital is great, and we have an Einstein's bagel, so it's been like going to get coffee or getting sushi when you're having to get lunch pretty fast has been good too, so the sushi's awesome.
Yeah, it's the small things, but like overall, like we don't have complaints. We get to wear scrubs every day.
Yeah,
we have our own office, we have our own like laptop, so you have all that to take care of. Like we have like a great support system, and you get to know each other. And overall I think there's just like a lot of positive things about this program.
Thank you.